I had a 11-pound tumor removed, and they had to remove it. They had to cut from here to here, and they put a plastic thing in there so that they could sew me back up, and so I deal with those pains. I'm pretty stoic during the day. I can deal with pain. Last year I had kidney stones and didn't even really know it because I've learned how to deal with pain during the day. But what medical marijuana does for me is helps me relax in the evening to sleep. So that by the end of the day I'm tense from being stoic and dealing with the pain and need to be able to sleep. And medical marijuana at the end of my day, when my day is done, helps me just be comfortable so that I can get to sleep. As a medical marijuana patient, it was really nice to be able to walk into a building and not feel like I was a criminal, to be able to walk in and know that there was someone who had information who could help me make the choices that I needed to make, who could help guide me down the road. It just made me feel normal. And I like that feeling, of feeling normal instead of, oh, well, I've now got to buck the system to find a way to get relief. My background is as an analyst, so I tend to take things apart and put them back together. And one of the things that I've been really working to use is edibles. And none of the edibles have really worked for me. And when I pick up an edible and it doesn't show what's in it or what it is, it's hard, that's difficult for me as a consumer. I want to know what's in that product. I want to see, I'd really like to see, I want to see the regular ingredients, but I also want to see what's in there gram-wise or whatever, so I can make my decisions based on that. So that would be something that I think would be extremely helpful. I chose Wellspring for, I went out of my way to choose the kind of dispensary that I would be comfortable with. And what I was looking for was someone that wasn't, that they looked legit, that they looked like a pharmacy, that they weren't just trying to sell marijuana. For me, it was important that I have a parking place or an area that I could park that was lit, that and if I went there at night, that I'd have some kind of security to walk me back to my car. Those things were very important to me. And not saying that all dispensaries have to have those things, but my dispensary, that's important for me. I think that the caretakers need to be, that whole definition needs to be defined more. I think the dispensaries are a good thing, and would like to keep them around. I don't know how many we need. I like the fact that they're looking at that someone who's going to own a dispensary has a clean record, and that I like that. And I also like the fact that we're looking at the doctors that are doing physicals. It should be something that people like my mother, who have had decades of propaganda, at least she could live with it. What's happening now seems out in the papers and whatever of robberies and whatever, if we can find a way to prevent that as best as possible. So the stigma is one of more of a business that, again, that other people who aren't as open to the idea of marijuana would be able to look at it and say, yeah, they're doing it the right way. So I really appreciate the dispensaries that are going and joining together